California Congresswoman Eshoo has some very, very specific thoughts on Medicare. Check this out. Leave your comments, ding the bell, share with your friends, and subscribe to our channel. With Congresswoman Anna Eshoo. So you're the chairwoman of the Health Subcommittee in the House. I'm curious your thoughts on what is being done right now to Medicare. I'm watching, since 2005 when Bush came up with Medicare Part C, which is the ability to privatize essentially Medicare with these Medicare Advantage accounts, and they're being promoted, and Trump is loosening the rules around them, and, as a way to encourage even more people to go with basically private health insurance, although they don't realize it because it has the name Medicare attached to it. But what's going on with all this? Where are we at?
Well, Tom, we did legislation on that earlier this year. What I would call them are junk plans.
Yeah.
Because they really cover so little, and I think that they are misleading. Now, the price tag, and people always shop to get the best price, is one thing. But the other is what you actually get for what you're paying. So I did an amendment to that bill requiring all of these what I call junk plans to say in bold print on the cover what the policy does not cover, which I think is really very important. But we're moving on and taking up a very large, important bill to lower the price of prescription drugs. Today, this Secretary of Health and Human Services is banned from directly negotiating with drug companies, and we're going to change that. We have direct negotiations, and they've been in place for a long time with the VA, and this legislation will allow the Secretary to directly negotiate with drug companies for Medicare, certainly Medicare Part D, because that's where so much money is. But all of the reforms that are in the legislation will not only apply to Medicare, but to all private insurance plans. Now, the bill has just been scored by the nonpartisan Congressional Budget Office, and it saves Medicare alone $345 billion over 10 years.
Wow.
So it's going to stop drug companies from charging Americans more for the same drugs but sell less for other countries. It's going to limit the out-of-pocket costs on prescription drugs for Medicare beneficiaries. Today, seniors pay up to $5,100 in out-of-pocket costs. Even though they're enrolled in Medicare, they pay that much out of their own pockets, and some pay even more. So under this new plan, every senior will have their out-of-pocket cost capped at $2,000. That's a godsend.
Yeah.
It's a godsend for so many seniors. And very importantly, the legislation takes the savings and invests them in innovation and research for new cures and treatments, and at NIH and FDA. And we're also going to invest these savings in new Medicare coverage for vision, for hearing, and dental services, which are not covered in Medicare today. So it's a very ambitious bill. In the VA, through direct negotiations, the cost of drugs for our veterans is 40% less. So this is, I'm very excited about it, and I think that it's a bill that is going to make a real tangible difference in the lives of people, and that's what we're elected to do.
Yeah, and
so
you're doing quite well.
About it.
Yeah. I think I'd be remiss if I didn't ask you about the gun violence crisis. Most people don't, you're on the health subcommittee, and a lot of people don't think of gun violence as a health problem, but I think it's a public health emergency if we've got 40,000 deaths a year from a single cause that's largely preventable, not to mention hundreds of thousands of injuries.
Well, I just held a hearing about a week and a half ago a field hearing in Chicago, right in the south side of Chicago, the epicenter of where there's so much gun violence. And it was really a rather historic hearing because it's the first time that we've had a hearing on gun violence as an epidemic, a public health issue and challenge. And so we received testimony from physicians, from victims, from city officials about how to treat gun violence for what it is, as you said, an epidemic. 96 Americans are killed by guns every day.
Wow.
Every day. Now, the House has already provided $50 million for gun violence research at the CDC and the NIH. One of the first bills that the new majority passed was the Bipartisan Background Checks Act. That requires universal background checks for all gun sales, and it closes the loopholes when guns are bought online and at gun shows. It's a very important bill. It passed the House. It's sitting in the majority leader Mitch McConnell's, I guess, bottom drawer in his desk. But I think that the advocacy and of the American people and that kind of pressure on the majority leader hopefully will lead to his taking it up, because this is bipartisan. It is an epidemic in our country, and we can do something about it.
That's great.